Hi dear friends, I am going to present about MRI scans. As you know that many people has the disease of stones such as gallbladder stone and pancreas related issues, or about many different stones at many places in our body. So for this and for the clarity of the issues like stones and other damages, kidney, liver, etc. There is a diagnostic method of MRI. I want to say that full form that it's magnetic resonance imaging scans. Through this in our body we can it is like CT scan. It is more powerful than CT scan. It is more powerful than CT scan, such as in a body, in liver, in kidney. If there is a damage or anything, then we can check out or find out the disease, what is the root cause of disease, and what is and at which place and which organ of the body the disease occurs. I am going to present or a video about this, that how MRI works and how MRI task is performed. Okay, just watch and share your thoughts. The introduction of MRI. MRI has a wide range of application in medical diagnostics, and there are estimated to be over 25,000 scanners are used in worldwide. MRI has an impact of on diagnosis and treatment in many specialists, although the effect and improved health outcomes in uncertain. Since MRI does not use any ionizing radiation, its use is recommended in presence of CT when either modality could yield the same information. I want to say that MRI is in general a safe technique, but the number of incidents causing patients harm have risen. Contradictions to MRI include most cochlear implants and cardiac pacemakers. I want to show that how it works. Okay, how MRI works. What is the full form of MRI? Magnetic resonance imaging. Okay, to perform a study of by the patient is positioned within an MRI scanner, which performs a strong magnetic field around the area to be imaged. Most medical applications rely on detecting a radio frequency signal emitted by excited hydrogen atoms in the body. As we know that as you and all know that our body has H2O, that is water, and it's in enough quantity in our body, water. In the body present in any tissue containing water molecules, using energy from a oscillating magnetic field applied at the appropriate resonant frequency. One more thing is that I want to share that MRI scan is related to soft tissues, and soft tissues is related to the contacting of the cells and tissues in our body. The orientation of the image is controlled by varying the main magnetic field using gradient coils. As these coils are rapidly switched on and off, they create the characteristic repetitive noises of an MRI scan. The contrast between different tissues is determined by the rate at which excited atoms return to the equilibrium state. As you know, equilibrium, such as when we react, as you have read in chemistry, equilibrium state. Exogenous contrast agents may be given intravenously, orally, and intra-articularly. MRI requires a magnetic field that is both strong and uniform. The field strength of the magnetic is measured in Tesla. You know Tesla? Tesla is the unit, remember. It is unit of any quantity, of a quantity, Tesla. Okay, and while the majority of systems operate at 1.5 Tesla, commercial systems are available between 0.2 Tesla to 7 Tesla. Most clinical magnets are superconducting, which requires liquid helium. The lower field strengths can be achieved with permanent magnets, which are often used in open MRI scanners for claustrophobic patients. Okay, I am going to present MRI scan, how it works, and how a patient is being checked by MRI scan. Okay. Takes on average 45 minutes to complete, which can be a long time in such a constricted space. How does that feel? Will it become a little bit uncomfortable? Just give this a bit of a squeeze. There are two things a participant is given just before they enter the machine: a rubber bulb, which they can squeeze to stop the procedure if for any reason they are uncomfortable, and a button box to perform the task they were allocated. Now, Phil, this is the button box for you to make your decisions with. The red button is for the left, and the yellow button is for the right. It's preferable the subject doesn't move the machine, as it will affect the quality of the data that is captured. मेरे पिताजी का किया आज ये
क्या था?
ये मेरे पिताजी का आज टेस्ट किया है।
आप पिताजी टेस्ट हुआ ये वाला
है?
ये टेस्ट है, ये आपके पिताजी का हुआ था? कौन सा टेस्ट है ये?
MRI।
MRI
बीमार चल रहे हैं ना।
अच्छा अच्छा, कहाँ पे? यहीं हुआ?
नहीं, सिल्लीगुड़ी में।
अच्छा।
बहुत टेक्निक निकल गया नया नया, एक से एक। ऑपरेशन तो फाड़ता था मशीन से ही,
ऊपर से होता है। साइंस बहुत आगे हो चुकी है,
बहुत स्टडी रिसर्च होता है आज से ज़्यादा। ये सब बताता होता कैसे है,
कैसे होता है उसमें बताओ।
मैग्नेटिक फील्ड जब पड़ता है ना बॉडी में, बता रहे देखे दिख जाता है कंप्यूटर में। यहाँ दिखता है ये कंप्यूटर में,
वो दिख रही है ना। इसे बंद कर दिया।
ऐसे चला देता हूँ, चला दूँ ऐसे।
चला लो, लग भी आपको
नहीं, मैं इसकी वजह से बंद किया था।
आवाज कर रही है इसलिए।
थोड़ा सा
तो फिर रहने दो बंद।
इतनी आवाज़ नहीं है, फैन कम कर दिया हूँ ना। ये आवाज़ आती है, ये खतरनाक आवाज़ है, डर जाएगा आदमी। बहुत सारा ये कैप्चर किया, ये देखिए डीज मिल गया इसको। यहाँ खराबी है, निकाल दिया। ये खराबी बंद निकाल दिया। कोई ज्वेलरी नहीं रख सकते अंदर, कुछ भी नहीं तो डिटेक्ट कर जाएगा वो कुछ। हर कुछ उतार देगा, घड़ी भी उतारना पड़ता है। बाप रे, कोई भी मेटल को क्लिक नहीं आ रही। नहीं तो डिटेक्ट कर जाएगा कुछ। न्यूरो मार्केटिंग बहुत अच्छा बताया है।